Hello, Ryan Rhodes, occupational therapist and Leckey product specialist for the Southeast region. Today we're about to just go over our MyGo standing frame series. We do have two sizes targeted for children from the ages of 4 to 14. So you'll typically see our individuals outgrow their Squiggles early intervention standard, and this would be the next model that we would move up to. The maximum weight capacity for our size 2, or the largest of our MyGo standing frames, is 132 pounds. It will accommodate up to a max user height of just under 67 inches, approximately 66.9 inches. Our MyGo is a 3-in-1 standing frame and is coded as such, so supine, prone, and upright. Some key clinical features that we have in the MyGo that makes the MyGo very unique is we have a hip derotation belt here, one for supine and one for prone. We notice often seeing some kiddos in standing frames, they may have a lateral block of some sort, but they're still starting to rotate when they're standing there. So with the way that this belt is placed on the child, we wrap their pelvis here, and if we need to correct a rotation, we're just going to pull in one direction and close up. Really gets those joints stacked over top of each other. Bones over bones is what we're looking for. The other biggest clinical consideration for our MyGo is the accommodation for hip and hamstring contractures. So often we see individuals, especially in this age group, that have had an onset of hamstring contractures that commonly they're exempt from standing frames and the fear that those hamstring contractures may be an issue. We're not getting the right contact, anything like that. So what we have here with the MyGo is the ability to accommodate these contractures by making this standing frame less linear. So on the side of our foot plates here, we have two 6mm markings that we just loosen. And we can bring these knee cups forward and tip it forward in that aspect, okay? So in a supine position, we're accommodating for 25 degrees of hamstring contractures. And even in the opposite position, if we were in prone, we can do the same as well, okay? So after we have accommodated for our hamstring contractures and isolated or rotated our pelvic back into neutral, there are plenty of other adjustability or key adjustment points for within the MyGo. Each individual foot plate can be adjusted 10 degrees and then plantar and dorsiflexion individually. So you're not flipping a dual foot plate down. If we have a contracture on one side, or for instance, an AFO on one side but not the other, we can individually adjust these angles. That also requires a 6mm key. There are 2 nuts on each side, 1 per foot plate. So we can accommodate different angles for whichever that we need. Underneath the foot plates here, similar to all of our other Leckey products, we have the sandals that will fit any foot plate that we have if necessary. When we need to switch from supine to prone, no tools necessary. We're just going to loosen this knob underneath our foot plate. And then we can turn our sandals so that we aren't binding our feet up in sandals incorrectly. So easy fix as a 3-in-1 standard. Easy to switch from supine to prone. We'll put this back into supine. Our knee cups are padded, and we have good lateral supports to avoid any kind of knee deformities while we're standing. We have 2 pad options. We have here our standard. We also have split knee cups. So in the instance that you have an individual that may have one of those severe hamstring contractures and that pressure on the patella is just too much for them, we actually have a bilateral knee strap that opens up, that lets that relief from that knee, that patella come through. Each individual knee cup, height, width, and angle adjustability is individualized. So if we need to pull one knee cup out a little bit further to accommodate a little bit more of a contracture on one side compared to the other, we can do that. Height adjustability for the knee cups. There's a hand knob on the back, so again, no tool necessary. So when we grow the standing frame, we need to make sure that we have our knee cups in the correct position. On the posterior side, which we'll get closer here shortly, there is another knob that allows us to adjust the knee cups laterally, medially or laterally as we need to make sure that we're getting good contact. So we have height adjustment, width adjustment, depth adjustment for the knee cups to make sure that we're fully enveloping the knee for that aspect here. When growing the entire frame, there's 2 white knobs down here that we just need to loosen up. I'm going to tip this back just a little bit, and I'll go over this mechanism here shortly. But for growth of the frame, it's a lot easier to get it more into a supine or prone position. Hand loosen these knobs. And we are quite a bit taller. Once we have our hip support raised up, a lot of times we're going to need to raise our knee cups. Sometimes, depending on the child's proportion of what their lower extremities are like, these knee cups aren't going to reach without the use of a 4-inch extension. We do offer those on our standard kits. However, you can order those retrofitted if necessary. Now that we have the height and hip support set appropriately, we need to address our lateral supports here. I have it set up at different angles for instance, if we had a kiddo that maybe had a pretty severe scoliotic curve going on. To adjust that in the back, it is just a 5mm wrench that comes with your multi-tool with Leckey. Just loosen that guy. That allows us for width adjustment, height adjustment, and then angle adjustment to wherever we need it. We want to really make sure that we're getting as much flat contact as we can with the ribs. For extra height growth, we have this cam lock here that we just have to loosen up. That allows us to add some height for our upper chest support. Similar to some of our other Leckey products with shoulder supports here, we can adjust the angle of this similar to an Adjust-A-Plush. It's a 6mm on top. We're going to loosen that up and we can angle that forward if we need a little bit more protraction. If we're in prone, a lot of times we'll probably see this a little bit more flattened, but that allows you to adjust if necessary with just a little key lock on top. Headrest options. We have 2 Leckey headrest options. This is our contour. We also have a planar headrest that has lateral supports that we can adjust if we're trying to pull somebody back to midline or just accommodate where they're at. With the Pro Series hardware, we can also put Whitmire headrests on here. So if we have a kiddo that needs a little bit more lateral support, anterior support, or anything like that, we're not just limited to the 2 offered by Leckey. For the final portion of the standing frame itself is the mechanism that gets us from supine or prone to upright. We have a pin in the back that we need to pull and hold, and then we can crank this in any direction that we need to bring them upright. You can lock it in at any angle that you would like. So as we're still working on getting a child to completely tolerate standing upright, whether it be for some osteopenia or osteoporosis issues, or if they're starting to have some hypotensive episodes, they're standing, we can start them slowly, pull them up to 40 degrees, 45 degrees in all that instance. Leckey does a really good job, especially in my opinion as a therapist, to have a measuring mark here. So often when we put individuals on standing programs, it's not always the therapist that evaluated them that's doing the treatment, so it's easy to document in that aspect. So if there's a therapy assistant of some sort that's going to be doing the main treatments, that's an easy way for them to document progress and continue to get their therapy. So as mentioned, the MyGo standing frame is a 3-in-1, supine, prone, and upright. So if we were to switch from supine to prone, of course we're going to need to remove our headrest, which is a great starting point so that we're not nose down into a head cushion. On the back here, we just need to back out 2 bolts. And of course, last but not least, we need to turn our sandals around. One thing to notice when you switch from prone to supine, especially if we do have some contractures of the lower extremities, is where our tilt is in our hamstring accommodation. Of course, it's going to be overly corrected when we switch from supine to prone. So keep in mind that we may need to make some adjustments to the angle of the lower extremities. To accommodate for that hamstring contracture with those knees a little bit forward in front of us. The tray is received on the front and back of the standing frame. Similar to most of our other products, the angle adjustability is built into the frame with just a swing nut here. So if we do decide to spend this standing time in a little bit of a supine angle like this, and we need to flatten that tray out for activities, we can accommodate that. The tray receiver receives on both sides, so you can use a tray for prone as well, especially when we're working on some of that neck extension while performing activities bilaterally. In conclusion, with our MyGo standing frame, just to reiterate that we have accommodations of up to 25 degrees of hamstring contractures while in supine and 20 degrees in prone. We have a very snug and secure feeling hip derotation belt that for both supine and prone to really get that pelvis aligned up accordingly underneath our spine while we're weight bearing. As well as this being a 3-in-1 standing frame and coated as such. So it is, again, supine, prone, and upright stander. Thank you very much.